Hello, everybody from around the world. This is Samson coming to you from Los Angeles, California. How is everybody doing today? Now, are you excited about what's going to happen? It's very exciting for me to be with all of you today. What we're going to have is a very special guest, and I know some of you have been waiting to hear from him all week. We have somebody that all of you know. He's a world famous scientist, researcher, doctor, and not only that, he's an amazing person. I was very fortunate to meet him in 2009 and have gotten to know him these past 10 and a half years. This gentleman, he has a heart of gold. It's all for the people, all that he does, and his life's work, many of us has taken it around the world, and his technology has helped thousands, well, I would say millions of people around the world, literally. So we're very fortunate to have him on today. So please welcome our very special guest, world famous doctor, scientist, and researcher, Dr. Nathan Newman. Hello, Dr. Newman.
Hello, that's so kind. You're very, I'm not that special. It's good. I'm, I am world famous thanks to you guys.
Well, you are very special, Dr. Newman. I think sometimes, people meet for a reason, and that reason may be not evident at the beginning, but you have blessed so many people, honestly. I have seen firsthand what your technology and your research has done for so many people. So it's really an honor for us today.
My pleasure to be here.
Yeah. Well, like we talked about earlier, we want to let people get to know you because I think almost everybody on this webinar, and we talk about people from Taiwan, Hong Kong, Singapore, Malaysia, Indonesia, Australia, Japan, Korea, US, Canada, maybe some people staying up very late in Europe too, and Latin America. They're so excited to be here, just to hear from you. Now, most people have seen you on stage. For those of you who have not seen Dr. Newman on stage, I'm sure you can go on YouTube and find him sharing his passion with the company. But today, I thought it would be very special to have him just for ourselves. Okay, don't tell the company. We just have Dr. Newman for ourselves to get an up and personal interview with him, where we can really get to know him and really understand where he comes from, where he's been, and where he's going. I think that's very exciting for all of us because we never talk about that on stage, right?
No time.
Yeah, right. Now, so today we have about an hour to do that. Now, I remember the first time I met you, okay, and it was in 2009. Randy and Wendy, they were all, let's plan a little event together, invite the doctor who invented the stem cell technology come and talk to us. And I was thinking, okay, it's very interesting. And at the time, to be very honest, I was just like anybody. I really had no idea of what that is. So I was thinking, well, it would be really good to hear. For me, as a very practical person, because my background is just business. I'm a business owner, right? So I've been in real estate, in the retail business as an auctioneer. So a very matter of fact, very logical. So I thought, wow, all this science sounds good, but does it work? So, but today, is very different now, 10 and a half years, because I remember shaking your hand. I was the one to introduce you at the event. At the time, I had a really cheap suit on, haven't made money yet. But I remember shaking your hand, and I could tell you were pretty nervous. So now,
I'm still nervous.
I think we had about 60 to 80 people there at that time. This was in 2009. So maybe Dr. Newman, we can start maybe just getting to know you on a more personal level because we never get a chance. So maybe if you can share with us your background, like literally, like where you're from and how you came to be a doctor.
My whole family, I think, is in our DNA. Our genes says doctor on it, I think. Everybody is doctor. My grandfather, my father, my brother, my nieces, nephews, everybody, we're all doctors. And I remember as a kid, I used to go to my father's clinic and, I was fascinated. I used to go and look at what he did and I loved it. And it's just part of what I knew I always wanted to be. It was just part of me. And as I grew up and I was in college, I loved the sciences. I used to take all the courses, and it was second nature to me. It was just easy for me to learn it. And I started my research actually when I was in college. I started to do uh, research at UCLA.
So let me ask you then. Obviously, everybody around you, your whole family, I guess it's not only your immediate family, it sounds like it's your extended family. I guess being a doctor is expected, huh?
Yeah, I mean, it's just who we are. Nobody forced me. In fact, my parents never forced me to become a doctor. I went and I sort of challenged it, and they were okay with it if I didn't want to. But I couldn't see myself being anything but. This is part of who I am.
Wow, that's amazing. I mean, not every young person, have that kind of purpose already. They don't. Most people they don't know. Very few people they do know. So, what drove you to be a medical doctor, specializing in dermatology?
In my time at UCLA, when I was doing the research, we were doing research on a very new product called Parasol 1789. 1789 is the revolution, French Revolution, basically. So it was a novel product to block UVA rays. Didn't have that before. So it was a sunscreen to do both UVA and UVB, and the whole idea of SPF, sun protection factor 30, was what I worked on. It was that research, and I loved it. I did all the research, we did all the testing, and I saw the results, and we wrote the paper, and it was just amazing. And it was one of those things that you say, I love this, and this is skin. And I started doing more things. And when I was in medical school, dermatology was something that I always got drawn to, and it was very much part of what I was looking to do.
Oh, okay. So then, as you went to school now, you also went to school in New York, is that right?
So I went to USC for undergrad, but I did my research at UCLA. And then I went to Albert Einstein College of Medicine in New York, and I did my training and got my medical degree there. Then I came back to Los Angeles to UCLA, and I did a internship for a year. And then from there, I went to Chicago to do my residency in dermatology. When I finished that, I came back to California, and I did a fellowship, which is another specialization in cosmetic surgery. So in cosmetic surgery, I got to do a lot of treatment, and during my residency, a lot of treatment using fat and dealing with fat. And I became very sort of infatuated with it, and there was different ways of treating it and what we were doing. And it was a time where everything that was to do with fat grafting was thought of as a bad thing, because the techniques were bad that we just didn't know. And as I was learning and I was seeing different techniques, I got more and more interested in it.
Oh, well, and actually well, for most of us, we have no idea. But it sounds like, a lot of schooling, huh? And then
Only 17 years after college,
wow,
after high school.
wow. And then a lot of hands-on, huh?
Yeah.
You
Well, I
know,
had hands-on even before, because I used to go to my father's clinic and I used to see it. I grew up with it.
wow, wow. So then, what made you decide to look into stem cells then?
So what we were doing in my residency and my fellowship was using these fat grafting techniques. So we would take fat from somebody's stomach or thigh and basically try to find a better way of injecting it back into another part of the body to either fix something or to give them a little bit of volume. But the techniques were very poor, and the results were very poor because what they used to do is they take the fat out, pour it in a sieve, literally like in a sieve, wash it with water, and then scoop it up with a spoon, put it in a syringe, and then just shove it all into one spot and sort of massage it in. That was the technique that was being used, and it was horrible. It
Oh,
didn't work. We decided not to do that, and I was learning from different people. So one of the techniques was to take it out in a syringe and not put it in a sieve and not inject it all at one time and just squeeze it in, but actually put little drops at a time to where you want and allow the blood flow to come in and let those cells survive. And we got much better results than the old way of doing it. But it was until a study came out of Japan that said when you take out the fat and you put it in a syringe, it comes out into 3 layers. The top layer is going to be oil, the middle layer is just fat, and the bottom layer is where all the stem cells are. Light bulb went off. I go, wait, that's why the old technique, putting in a sieve, didn't work, because all the stem cells were being washed away and you didn't get any take. It didn't work. But here we were keeping it, and our technique was making it much better. So I said, what happens if you now not only just keep it, but concentrate it and inject it back? And I started developing a process called the stem cell lift, where we take the fat, concentrate the stem cells in there, inject it back, and we get much, much better results. It's just a different, it's really revolutionizing all of medicine.
wow. And you know what you say? It makes a lot of sense to somebody like me, just a layman. It makes perfect sense. I'm like, how come they didn't do that for so long?
Because we didn't know where the stem cells were.
Okay. So then, all the studying and work, when do you have time for personal life, right?
Oh, I have a good personal life.
Yeah, I know your wife is amazing, and
Yeah, I'm very blessed.
and you have so many kids, like a dozen, right?
Yes. No, just 4.
Well, I mean, so going back to the science is very interesting, because when I first heard it, I'm like, wow, this is pretty amazing. And I remember 10.5 years ago, I mean, the news of just starting to come out where people were, the doctors, the scientists were using stem cells to grow maybe cartilage or maybe a ear or finger or something like that. I remember at that time.
Right.
So then what happened? What made you, I mean, I guess because you're a dermatologist, and how did you decide to create consumable products for the average person? I mean, how did it jump from, the fast sculpting to, products that people can use outside of your office?
I'm going to show you because I think.
Okay, it might be his internet, folks. So, I mean, so far, let's have him log in again, and we'll go from there. Okay, we'll continue. So folks, I mean, so far, as you can tell, Dr. Newman, did you notice that when he talked about the science, he's smiling the whole time? I mean, obviously, it's really in him. And that's one of the reasons I want to bring him on the interview with all of you, because, when I first met him, he was just a very nervous doctor, literally. And then over time, he got better and better at, speaking. And from there, the science and all that, he started really developing. We're just about to get into the meat of what he does. Okay, so hopefully he can log back in quickly, and then we can start again. But he's very passionate about what he does. And like I said, I remember 10.5 years ago when I shook his hand to introduce him on stage. His hand was really, really wet. He was so nervous. But, having most of you out there on this webinar already have used the products from his technology. And it literally, at that time in 2009, people start looking younger and younger and younger. So at the time, we're thinking, wow, you know what? Most people, especially ladies, if they use their skincare or makeup, you know what? 10 years later, they're still going to look 10 years older. But many of us who use the serum, we're going to stay young looking and healthy like never before. So at that time, I just thought, if the products work, we can have a fantastic, fantastic business. And, the proof is in the pudding. I think our line of product, the skincare, is number 2 in the whole company. that we do hundreds and millions of dollars every year just by simply people using it. And for me as a guy, very simple. When the serum came out, I just washed my face, put a drop on or two. That's it, day and night, morning and night, before when I wake up and before I go to bed. So that's how it was. Anyway, we're still waiting for him to log back in. As a matter of fact, you know what? Since we're alive and it's all family here, I'm going to give him a call. So, all right. Hello, Dr. Newman.
Okay, I'm about to log in again.
Okay. Hey, I think
don't know.
maybe too many of your kids are on the internet.
I think so.
All your dozens kids. Okay. All right. We'll wait for you. Okay. We're still live, so we're good.
Great. Let's see if I can get in. Here we go.
All right. Okay. Thank you. Okay. So he's logging back in. I don't know if you've heard the conversation. So, yeah, he has a very busy household. He loves kids. He's a very busy guy, and I don't want to spill the bean, but from his clinic, he has a clinic which is the whole floor in this building, the medical building in Beverly Hills. I've been there a few times to visit him and talk with him. And for those of you, anyway, those of you in the business, if you go do something, you can actually get a discount. Okay, he's not on, but yet, but I can, go ahead and publicize for him. So today our intention is just to get to know him on a deeper level, so that all of you can feel even more confident and be proud of the business that you do, the products and technologies that you represent. We're going to create some values here besides what he does. Okay. Hello, Dr. Newman. You're in.
Sorry about that.
No worries.
Okay. Let's try this again.
Okay. All right. So we were talking, you were just about to share the science, right?
Yes. I was going to share science and then it got frozen by technology.
Okay. Well, let's rock and roll. Go ahead.
Okay. So you see my slides now?
Yes.
Okay.
I can very well.
Very good. So we talked about the stem cells being part of all the tissues, and the fat has most amount of those stem cells. And the stem cells can be used for many different things. The stem cells from the fat, we can use it to make bone, cartilage, muscle, fat, skin, nerve endings. It's amazing what we can do with it today. And I've used it in my clinic for cosmetic purposes, like doing a 3D facelift without having to cut you, without having to go under general anesthesia, no scarring. It's much safer. It looks natural. Nobody can tell that you've had it done, including me. I have to go to my notes and see what I did to remember like what the changes are and where I injected it. We also started with doing reconstructive surgery. So the reconstructive surgery was to do post-cancer reconstruction or people who were injured, and we saw amazing results with that. For joints, I do knees and shoulders and hands and all the people, we can save a lot of knee replacement because of it. Autoimmune disease, skin diseases that are very debilitating for people, we've treated with stem cell lift and they're feeling a lot better. And right now, actually, I submitted to the FDA our stem cell technology to help people who are on respirators so we can hopefully save some lives. And as soon as I hear back from the FDA, we'll be able to maybe get some of the product to people's hands to see if we can save some people. How I got my stem cells, we got to go after it. We got to get it out to the world. Herschel was a patient who had cancer in his face that was cut out. Then they did radiation on the face and it left a big hole, scarred down, and the skin was burnt from the radiation. His nerve endings were trapped in the scar over there. He was in constant pain. He was a young guy at a time with a big hole in his face. It didn't do him really good for his self-esteem. He was depressed. He didn't have any social life. He had gone to all the big universities and all the big doctors who were known for reconstruction to correct this problem. And he couldn't get anybody to fix it because anytime they would inject or cut the skin, because there was no blood flow from the radiation that kills all the blood flow, the skin would start to die and they would have to stop. He had heard about me doing stem cells. He came to my office. He said, I want you to do it for me. You think you can fix this? I go, I can improve it. I don't know how much I can improve it, but we can try. I started injecting him. I injected him every 3 months for 2 years. So that's 8 treatments. I was amazed how fast and how soon the skin burn started to go away. His skin was not stuck down and scarred down like before. All of his nerve pain started to go away. And at the end of the 2 years, his jaw was back, and he was back to being a confident person. And I looked at this saying, oh my God, look at what we just did. We got to be able to do a lot more with it. And I started studying it and seeing what stem cells can do. And when we were looking at our cosmetic patients, we were also seeing changes in the skin. And we were seeing these changes happen very quickly. And these were, when you do things.
All right, folks, he's kind of cutting in and out. I hope he comes back. He's just getting to the good part. Sorry about the technical difficulty, everybody. Okay, so hopefully he comes back in a second. All right. So as you can see, the technology that he uses with the stem cells acts very fast. And, when I first met him, like this picture, all of you, I'm sure can still see it, that, it's after 7 months, and the volume that it replaces under the eyes. I mean, a lot of people have baggy eyes, or they maybe got herniated fat, so it's puffy. Well, I mean, he can correct all that and tighten that with his science. It's pretty amazing. Anyway, it's amazing opportunity to have him on. So maybe if you don't mind, for those of you who are on, I know we've originally planned for an hour, and we were going to talk for about 40 minutes and do some Q&A. Would you guys like to do some Q&A? If you want, type yes in the chat. I see a lot of people asking questions. We've been going through it. I did talk to Dr. Newman beforehand as we're preparing for the webcast. I think, look, if it's anything pertaining to our products in our business for medical uses, he won't be able to answer anything directly today. But rather, if, the general rule is, if you're concerned, if you have certain conditions, it's always best to consult with your own physicians first, okay? So anyway, so yes, he says he's logging back in. There he is. He's back. He is back. Okay.
Sorry.
All right. Okay.
I've never had that happen. I've got all this things never happened. I'm sorry.
No worries. You're just too hot. Too much energy over there.
I think so.
All right. All right. Yeah, no, people are excited. They want to hear some Q&A later. Okay, so let's keep going.
So we looked at all these growth factors and all the things that the cells were producing. Here's like a sample of all the factors that we looked at, and hundreds and hundreds of things we looked at and tested, and we found that it doesn't really matter what cells what you do with the cells. It's the environment that you grow the cells in. It's what sort of you do to them that ends up giving you what the different factors are. And those factors are like polypeptides that we have in our technology. And the great thing is, since I started doing this in humans, now we can do it like in any cell, and we can get those polypeptides, which is amazing. We can do so many things today that is going to just change the world, and we're doing it, and we actually submitted patents for this technology because it's never been done before. And I'm really excited about the possibilities, what we can do for the medicinal and for people in terms of medications and things that will help them have results without all the side effects of medications today. And we look at all these things, and what's amazing is we can see that cells from different things like humans and plants and animals, we all have the same basic things. So you can have it make whatever you want without having to worry about the cell itself. Is really what environment we put it in is what gives us the product. And we looked at all these things, and we deciphered, how to sort of move the put the cells in the environment that we want to get the set of factors that we want, the set of polypeptides that we want. And that's really how we tested these, and we figured out which one is good for skin, which one is good for pigment, which one is good for hair. And that's how we came up with products. And when I started doing this, we were actually trying to heal wounds. We were trying to treat burns. And you can see, like, after this was a woman had a problem on her leg that wasn't healing for, I think, half a year or something. She had done all the creams, all the things that the doctor's given her, nothing had helped. Comes to me 2 weeks of putting on our product over there, and it started healing. And here's somebody who got a burn, puts it on, within 8 days, the burn is gone, no scar, you know, and a kid that was, you know, grandmother was a patient of mine, and they called me frantically, or, you know, our nephew's burned, what can we do? They bring him to my office, and we put our product on there, and like within 2 weeks, everything, all the skin had healed. He had no pain. And then after a month and a half, he comes back and the whole thing is just healed. It's got a little bit of redness and that's go. There was no scarring. Any other thing they would have done, this kid would have been scarred. And I was blown away at the results. And I think as we're doing more, we're learning how to improve this. One of the things we did was we looked at stem cells in hair. See, I was trying to get it for myself. I'm still trying to get it for myself. But what happened was we published this in a scientific journal, how stem cells play a major role in the hair and how we can stimulate it. We actually developed the set of growth factors for the hair, and then we tested in our lab. On the top are the stem cells that are grown in normal condition, and they don't change. But on the bottom, the stem cells that are grown with our product, they turn to hair. They are changing because that's what their job is to change to different types of cells. That's what they're doing. They're changing into hair cells. And I thought, great, I got it. Let me put it on my head and we got to get it. I don't have enough follicles. I'm 9 years too late. If I had done this 9 years ago, I would have kept my hair. But I'm still going to figure out a way to get it back. But what happened was my nurse, and some of you may know this, my nurse lost her hair and she sort of became depressed and I couldn't have this. So I said, here, use it. And 2 months later, her hair is coming back. 4 months later, look how long it is. And a year later, her hair looks better than it did before. And this is like, if you were just to leave this without treating it and using regular treatments that we did, first of all, she would have to get shots in her head. It may thin out her skin. And if it comes back, it may come back half as thick as before, and it will take probably a year or so for it to grow. So when I saw this, I was like, okay, this is amazing. If this is what we're doing, we got to be able to do this for other people. And that's why we tested it on other people, saying, okay, let's see what happens. And these are people who came to my clinic and said, okay, I'm willing to try it. And you can see how much the hair gets thicker as you use the product. You know, it not only gets thicker, but it also gets more healthy, just more controllable. It's not just like a Brillo pad. And wherever we didn't have the follicles, like here, if you don't have the hair, it's not going to grow. But the area that you had the hair, look how much thicker it is. And we knew that it works. And we tried it in women, and it worked even better because they don't lose all the follicles. They just get thinned out. And you can see how much improvement you get. And for women to lose their hair, it's the most devastating thing. They're so thankful that we could have done it. And most of these patients that I treat, is like a life-changing event for them. And that's really what drives me, because we can see the changes in the people and how we can improve their lives. So that's what I'm going to share with you in terms of photos.
Wow. I mean, those are amazing. Now we have a lot of questions, and I think, you know, just because I think, since 10 and a half years ago, when we first started our business and knowing you, obviously, from what I hear today, the technology has changed, number one. So back then, you were working with human stem cells. I mean, I think it was like PRP, something like that, plus, all your stem cell lift, right? So then how did it?
Yeah, it became after.
Yeah, yeah, yeah. That's right. So now you were able to transition, and if I heard right, you recognize that plant or human, the growth factor or peptide is still the same. Is that right?
Yeah.
So cell to cell communication is still the same. It's just even though the DNA is different, the peptide. Am I describing it right? You can correct me if I'm wrong.
Right. I mean, it's a matter of, it's like, what language are you speaking? Are you speaking English? Are you speaking Chinese? Are you speaking Latin? Are you speaking sign language? It doesn't matter. Communication is communication. These are chemicals that are doing it. And all the cell genetics are all the same. We're basically the same thing. And it's incredible how similar we are. The more we learn, the better we know how we can do it. And it makes sense why all these years, Chinese medicine and other, Ayurvedic medicine, they use plants to heal people because those things are in the plant that your body recognizes. It's the same language that they're speaking. Otherwise, it wouldn't work.
That's very beautiful because I didn't think that way like 10 and a half years ago because, peptide growth factors for plant wasn't that popular yet. But, through your research, you've really gotten down to that HPT6. That's amazing what to hear. So obviously then your nurse, the condition she had, she still had the follicle, right? And it was the growth factor, the serum that you put on her and it made it all grow back, huh?
Right.
Now, how many growth factors are out there that you know of?
That I know of? Thousands.
Is that right? I remember
Yes.
when we first started, it was 200 and 200 and.
That's how many we studied that we knew what they're doing.
That's right? It was like, what is that, 200, around 230 or something like that when we first started. Yeah. And now there are thousands. Is that right?
Yes.
Wow, that
we
is
still
amazing.
Don't know what all of them do, but we know that they exist.
Oh, okay. So I won't go too technical today. We'll have a private conversation about other things. But so then, since the science is evolving, I heard, I don't know if the audience caught it, but you mentioned you are working on a product that's waiting for FDA approval to help with the coronavirus treatment therapy. So what growth factor is that about?
So they're anti-inflammatory growth factors and factors that fight viruses. Actually, your body secretes them to fight viruses. So we have the ability to make those. And we already know that certain things have worked in the past for certain viruses or certain inflammatory conditions. Nobody's done it for lungs. And this is the reason we need to do it today, is because people are dying. And if we don't do it, they're not going to leave the hospital, because 80% of the people who get put on respirators do not leave the hospital. So we want to save them.
Yeah. Wow. That's very big. So that's amazing. I mean, it seems like this thing just came up on us, a few months ago, and you already have the know-how treating the inside anti-inflammatory. That's amazing.
Yeah, because we have the 20 years experience. We have a lot of knowledge of what these things do and how we can get the cells to give us those polypeptides.
Wow.
Or those factors.
Oh, no, that gives a lot of people hope. That's great. Yeah, technology is out there, and thank you for putting it forth, and hope that it gets FDA approval and can help a lot of people. Thank you very much for that. Okay, so now let's see how much time we have left. So it's about right now 7:12. We can go over a little bit past 7:30 because of the technical issues. So where do you see your science going? What are you working on in R&D? What's the future like? You don't have to tell us a specific, but what direction is it going?
Well, for R&D, I have two R&D wings. One is for the medications and that we're trying to make for the FDA approval, and that always takes time. And the other ones are using our technology for the cosmetic world to bring things to the market that will change how people are being treated, really moving things along in a way that hasn't been done before. Just like we did with APT 200, and to this day, nothing is like APT 200, that you can put it on and within like a month, you see a change in your skin. No product can do the changes that these factors can do for you. One of the things that happened was we have a lot of people who are complaining of pain. And we decided we have anti-inflammatory products here. Why don't we do that? So one of the things that's probably going to come out very soon is for joint pain and muscle pain, and that you don't have to take a pill for, you don't have all the side effects, is going to work almost immediately and is going to give you real relief.
No, that's amazing. That's great. Can't wait. Yeah, that's the future. Now, we can probably move on to the Q&A, right? I mean, is everybody happy with Dr. Newman so far? If so, put yes in the chat, okay? Let's all cheer for Dr. Newman, okay? There you go, okay? And chat's going, okay. Now, I saw, there's some medical questions, and, obviously, I think being responsible, there's no way you can give any diagnosis, okay? So maybe, though, we do have a question, maybe some generalized question, just, of course, we can tell them to, check with their doctors in the local area, right? So somebody asked, they have like a lupus and other things. Let me see, where did that question go? Because a lot of yeses popped up right at the time.
Rheumatoid arthritis.
Yeah. She has rheumatoid arthritis and lupus. Can stem cell treatments help her? From a scientific standpoint, and maybe, she can seek out a doctor.
Right. So autoimmune disease is one of the hardest things to treat because your own body is attacking itself. And we don't really know why, and we don't know what triggers it, and we don't know how to stop it. That's the limits of science. What stem cells do is they just stop the autoimmune reaction. We don't know why, but they do. They fix whatever the problem is, and they stop the autoimmune reaction. At least that's what I see in the autoimmune disease that I treat in my clinic in the skin. The problem with systemic autoimmune diseases is that you're concentrating all these stem cells and then you're putting in a blood vessel and it's getting diluted throughout your body. So you don't really get that force of millions of cells being in one place. So,
hello, Dr. Newman.
3-4 months and they get back. But they've tried it in different places around the world. The problem is in the US, FDA doesn't allow you to do these things, and there's a lot of limitations to what we can do in the US.
I see. Okay. You cut out there for a little bit, but you were saying that before the 3 or 4 months or something like that, you got cut off there.
Sorry. So what happens is they get better for 3 to 4 months, but then they may get back to having symptoms, and then they need to get another treatment again. So it doesn't cure it, but they can get some relief. And that's been sort of the reports that we've gotten amongst the stem cell doctors that we talk to. But there's no like studies, there's no major studies. The US doesn't allow you to do any major stem cell things anyway. So it's very limited to what we can do.
Yeah. Well, actually, I know Louisa. So maybe Louisa, who came up with the question. Actually, why don't you direct message me later on WhatsApp and we'll talk a little bit. Okay, so we have questions coming out now. Are growth factors the same as polypeptides?
So the polypeptides are what we have in our product, because growth factors, by definition, all they do is promote growth of something, right? Mm-hmm. Polypeptides, not necessarily doing that. You have anti-inflammatory factors, they're not growth factors. So, and a lot of people get confused between growth factors and growth hormones. We're not growth hormones. And you may have some growth factors in the polypeptides, but most of the polypeptides in our skin is to improve the skin, is not necessarily to grow the skin.
Very good, very good, okay? So growth factor means grow, literally growth. All right. Okay, there's some questions that pertain specifically to the product, but I would say that okay, can the serum they use the serum in the eyes? What would you say?
I don't understand how people started doing this. I know people tell me that they use the product in the eyes. Obviously, we didn't make it for the eye.
Yeah,
It is, I would not recommend anybody to put it in the eye. But everybody who I come across who's used it in the eye tell me that they got improvement in it. So we're actually looking at the product for the eye, but it will not be through a cosmetic company because those things are considered medications
you're right.
if you go into the eye.
But you're saying you don't recommend it.
Yeah, I don't know how good it is to put that in the eye.
All right.
It's not formulated for the eye. The
Yeah.
eyes, you got to be careful what you put in it.
I know. I've heard that rumor around the world. So somebody asked, okay, the RVL, the shelf life, can it be around for a while, still be good, or is it a better way to preserve the shelf life?
Well, any product you have is better to keep it in the refrigerator. It will last longer.
Mm, okay.
So if you put a product in the heat, it's going to break down. If you put it in the cold, it'll last longer. But once it expires, I would not.
All right. Okay. Getting cut off again. Hopefully Dr. Newman comes back. He's frozen again. Hello, doctor. Are you back?
Am I frozen or you're frozen?
Okay, you're frozen. Again, you were talking about putting the product in the refrigerator, it'll last longer. And then at the expiration date, what about that? Okay, just let us know when you're back. Let me take a look at the questions. Is ATP same as growth factor? I think that ATP, what it means is that the ATP 200 is a patented technology that has the growth factors and peptides, okay? Okay, somebody asked if we have sunscreen lotion for the whole body. Okay, Dr. Newman, if you can, you're still frozen. Are you back, Dr. Newman? Oh, we can see you now.
Okay, good.
Okay, yeah, the internet is very slow. Okay, lost you there. So the RVL, you were saying that, of course, it lasts long in the fridge, but about the expiration date, you were about to say something about that.
So basically, if you keep it in the refrigerator, it's going to last longer. But once it expires, you don't want to use it. Once it expires, it's finished. You should get a new one.
Okay. Yeah, well, I mean, for those of you out there, I don't know, if you're going to get some product, you make sure you use it, okay? You got to make sure you finish it to get the result. And use enough to get the result. I mean, I was so impressed with picture from your nurse who used it for 1 year, That's amazing. So yeah. I'm just going through the questions. Now there's a lot of questions. Somebody asked, Frame asked, the skin has been uneven for more than 20 years. Jeunesse products have been used for several years. How can they be completely restored? So without seeing you, I'm sure Dr. Newman will have a hard time diagnosing you. But maybe, can you comment on that, Dr. Newman?
I think, people have different responses to different creams and they have different issues with their skin. So I'm not sure what the problem is. The uneven skin is, from acne scars, there's 1,000 reasons why you can have it. I don't know what I can answer because I haven't seen the picture and I don't know what the problem is. So
right. They just have uneven skin. So if it's acne, I have seen people from the acne scars because the collagen growing, it helped to look better. Okay, so we have a couple of questions. Maybe you can just comment on that because it's a medical question about eczema or psoriasis. If people have those conditions, maybe you can make some comment about that. And this kind of technology, is it applicable for that or?
So, eczema and psoriasis are, again, autoimmune diseases, especially psoriasis. Eczema can be, is a question of what triggers it. But the reason we don't really have a great way to treat these things because we don't know what they causes. So you have certain biologics that they are being marketed now that have been accepted using one factor or one secretory factor with some response, but they have a lot of problems with it. The product that we have, you can put on, it'll help it, but I don't know if you're looking for like a cure, I'm not sure if anybody has a cure for it today.
Good. That's great. That's great. That's great information. So, and of course, everybody's a little bit different. So I do have somebody ask, can they add water to the face when using the products? What do you think about that?
Usually I tell people to wash their face first and just dab it dry so that there's still moisture on the skin. If you don't want to really put things on dry skin, you want to have a little bit of moisture on the skin. So when you put the serum on or when you put the creams on, it traps that moisture in and gives you that moisture within your skin.
Okay. So you don't recommend, like, if I put a drop of serum, take a little few drops of water, even it out because I'm cheap or something, and then put it on like that. No, right?
I've never done that. If that's what they want to do, is okay. But I think if you wash your face and not dry it out completely, just dab it dry, you're gonna get that moisture, and it'll be easier to apply the products as well.
Okay, great. Now, I think there's going to be countless questions coming through, but time is limited. So, but to wrap it up, maybe because this came to my mind when we were talking last week and also this week about what it would be your recommendation. Okay, now we're in an obviously unique situation with the virus. We're not supposed to touch our face. Why is it important, actually, more than ever, to use the skincare that we have?
So I've had multiple people calling me over the last month talking about how their hands are all dry and cracked and painful and red and infected because they've put so much alcohol on it or they've washed their hands so much. We have a protective layer on our skin, is the sebum. Sebum is oily. And if you get rid of it, you lose a protective layer and then you're prone to getting inflammation and then drying out the skin and getting infection. We even know that corona likes to hang around more when things are dry. So you don't want to have cuts and dry skin and then have itching because you're dry and then touch your face with it, and because the whole point is to not do that. So you want to moisturize your skin every time you wash your hand, or if you put on a sanitizer, you want to put moisturizer on. The most important thing is to keep that moisture and the protective layer on your hands, on your face, so that you don't get that reaction and you don't get the itching and you don't prone to touching it.
Wow.
Moisturize a lot every time.
Okay, so then maybe we can do like this. So maybe to conclude, how do you recommend people to use the products right now, or the right way to use the product? Can you share with us?
Sure. I think the powerhouse, both the Reveal and the Luminous skincare lines, are the serums. So the Scalp Infusion has got the most amount of HPT6, and the Cellular Rejuvenating Serum has the most amount of the APT200. That is a must every day. And then on top of it, you want to moisturize. So if you're feeling very dry, I would use the night cream because that's the most thicker moisturizing product. If you're not so dry, you can use the body lotion on the hands, and on the face, you can use the morning moisturizer with SPF. But if you feel dry, apply Advanced Night Repair more than one time during the day to make sure you keep your face and hands moist.
Wow, that's good. What about the masks and all that?
So the masks are great because they will get rid of the oils and excess oils and the dirt, and it will make your skin more supple and moisturized. But if you don't have the other things, that's not enough. So I would do the masks. I know people love to do the Ultimate Lifting mask at night and leave it on at night. If you're going to do that, make sure you put the serum on before and the brightener on before, and then put on the mask and sleep with it on the face and neck, and then you can wash it off in the morning.
Okay, very good, very good. Well, excellent advice. Well, since the time is limited, unfortunately, folks, That's all the time we have for today. But I hope today that all of you out there have got to know Dr. Newman up close and personal, and probably in your living room or car right now. And we want to thank Dr. Newman very much. Like I said earlier at the beginning, sometimes we will come together for a reason. And this technology that you have created has inspired those of us who are just laymen to really go out there and make something of ourselves, and also to help other people. And now you got an army of people looking 5, 10, 20 years younger than they're supposed to be. Did you ever thought of that?
It's amazing. It's amazing. I love it. Thank you so much for putting this together. I appreciate your team, the fact that they're listening, the fact that they're so passionate and they're asking such amazing questions. I hope this was useful for you and your team. And I wish you guys luck. And I want to see you guys hopefully in person very soon.
Yes, yes. Now, in the future, are you open to doing more webcasts with us?
Sure.
Oh, excellent, excellent. So we can plan some in English and maybe plan some in Chinese. Would that be okay?
Sure. I would love it.
Excellent, excellent. Well, folks, thank you very much for logging in from all over the world. It's been a very exciting hour, even though we had a little bit of technical difficulty. But we'll put this video together, put it on our YouTube channel for your reference. Thank you so much, Dr. Newman.
Thank you so much.
Please give my regards to your wife and kids. Okay. Thank you so much.
Thank you very much.
Okay.
Bye.
Thank you. Bye bye, everybody. Thank you. Thank you, Dr. Newman. Thank you.